Hi everyone, I hope you guys are keeping well. In this video, I'm going to answer one of the most common questions that you've been asking me about, do I need an MRI report if I'm experiencing an acute lower back pain? The short answer is no, you don't need an MRI report. I'm going to briefly explain for you with 3 valid reasons that you shouldn't apply for MRI report if you're suffering from an acute lower back pain. Let's go through it. If this is the first time that you're watching my channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update and don't forget to press that like button. The first reason that you shouldn't go for an MRI in acute phase of lower back pain is that the results can be misleading. What does that mean? What a study and research has shown, up to 86% of population could have seen some sort of degenerative changes, disc bulges, herniated disc in their MRI report without having any symptoms or pain. And in that case, if you are going for an MRI in acute lower back pain, you might have seen with those kind of reports and come back home and you see, oh my God, I have a disc bulge, I have a degenerative, basically changes in my lower back, but in 86%, up to 86%, these results are part of a life, which means it does not correlate with pain that you're experiencing. The second reason that you shouldn't do an MRI basically scan in acute low back pain episode is the results can basically freak you out and create catastrophe. When you find out that you have a disc bulge or herniated disc or degenerative changes in your lumbar spine, many individuals get panic and start to overthink and start to do things a little bit differently, and that can cause problem in the long run. If you think about it, as soon as you realize that you have some sort of changes in your lumbar spine, you start to think, okay, should I bend forward? Should I pick this? Should I actually do these things as usual? Or should I be careful about my back? The last but not the least reason that you shouldn't go for an MRI scan is that acute lower back pain gets resolved by itself, which means in many cases you shouldn't do anything. You just carry on with your daily activity and avoid activity that bothers your lower back, and you will see within few days your back settle down by itself. In many cases, my patient call me and ask me, should I come to the clinic for my lower back pain? And I ask them if it's acute. Just take it easy, do what you do, avoid things that bother your back, and your back gonna get better by itself. I hope you guys find this information helpful. I haven't even mentioned about the cost of MRI scan. That would be something that would be around $250 to $300, depends on where you live, and that would be something that you don't want to spend to get those information in anyhow. I know we discussed about acute lower back pain. I don't even send my patient for in chronic cases to get an MRI report either, because it's in many cases does not correlate with pain, and it basically freak them out and they find out they have some changes in the lumbar spine and they start to do things differently. Now, if you have any question regarding MRI report, lumbar spine, disc bulges, herniated disc, whatever you have in your mind, you can leave me a comments and I would be more than happy to help you and get back to you with some sort of solid information that you can actually apply on a daily basis for your recovery. Make sure to subscribe my channel for my weekly update and don't forget to press that like button. I appreciate your comments, your like and subscription, guys. Thank you so much for inspiring me and asking me all of these questions, and I create this content based on your question. Don't forget to leave me a question underneath of this video. Until next week, all the best.